And this afternoon, we're talking about coronavirus. And most importantly, we're answering some of your questions. It has been absolutely amazing to have the conversation with you over the weekend. I think we must have gotten at least 1,000 texts from viewers with, concerns, questions, just wanting to keep the dialogue going because things seem to be happening so fast and furious. So we want to have facts, not fear. We don't want anybody to freak out, but we do want to pass along really important information. And we have just the man to do it. Dr. Christopher Cirino with Adventist Health is joining us on our live stream today. And he is an internal medicine specialist. He knows about infectious disease. He works over at Adventist Health, as I said, at the Fano Creek Clinic. And he's had like 20 years experience doing this. Dr. Cirino, we really appreciate you taking time. I know that you're a busy man, but we do have a number of things that we want to cover. So thank you so much for joining us today.
Thank you very much, Brenda, for having me here.
Before we get to some of those questions, I do just want to pass along a couple of new things that we've learned. I anchored the Sunrise Show, and since we went off the air, we've learned a couple of new things, and I wanted to pass that along to our viewers. First, our sister station in Seattle, King 5, is reporting that there have been 5 coronavirus deaths in King County. And then there is 1 death reported in Snohomish County. So in Washington State, there have been 6 fatalities from coronavirus. Also, we got some new information here in Oregon that there is a 3rd presumptive coronavirus case. It's been reported that a person in Umatilla County is now in the hospital in Walla Walla, Washington, and had a coronavirus diagnosis. The person apparently was attending a youth basketball game in Weston, Oregon, and our KGW reporting is saying that they've closed the gym and they're deep cleaning the gym, but fortunately that gym is not kind of connected to the regular school building, so that's not a threat. But those are just a couple of new tidbits. I'm going to let you just start off because I know you've probably had a lot of patients asking questions of you. What do you want our viewers to know, just kind of as an overview before we dive into the specifics? What would you like to pass along this afternoon?
Okay, well, I think it's important to really take into the context. When we often talk about things in the news, we often talk about the deaths that are occurring because of a disease. I think it's also important to bring up that most people will have a very mild disease, similar to a common cold. Which is also a coronavirus in some cases. So I think it's important to mention that it's sometimes it's easier to think about something is coming and it's really causing havoc in us because there's a risk that we could die from it. And I think that's also could be generating fear. What I think on the other side of this is if there are 6 cases now within those counties in Washington, it does bring up the possibility that there is probably local spread that has been occurring for several weeks. If we know about mortality rates, fatality rates here being somewhere around 0.7%, we know that there's probably a lot of other people that could be having the disease and either having a milder case. So it's something that I think as we get the testing more available in the community, we're going to be aware that there may actually be more cases.
Okay. And we also want to invite people, if they have a question that they would like to ask you, you can text us the question at 503-226-5111, and we will be monitoring those and then asking the doctor on your behalf. So I know I have a couple that came in early. Can you just kind of set the record straight? I'm just going to run down the ones that we have. So somebody wants to know, can regular flu turn into coronavirus?
No, that would not be possible because the flu is caused by the influenza virus. I think maybe they might be thinking about the fact that coronavirus can cause flu-like symptoms, but no, these are 2 separate viruses.
So can you talk real quick about the symptoms? What are we looking for? What are the hallmarks of coronavirus?
Okay, the general symptoms are similar to other viral infections that affect the respiratory tract. So, runny nose, cough, sore throat sometimes, nausea, general symptoms as well. And sometimes we can see increasing breathlessness, problems with breathing in more moderate or severe cases. So the general symptoms are pretty widespread, very similar to other viral respiratory infections.
So, somebody else wants to know, what steps should I take if my immune system is weakened?
Okay. The steps should be very similar to what you would normally do during the flu season. Vigilant hand washing, certainly some social distancing where you would avoid someone who may be sick, maybe having them not come over to your house or staying away from someone who is coughing. Certainly avoiding handshaking makes sense in a high flu season as well. So.
Here's another good question. How long will we see the effects of this virus strain? Do we even know that?
I don't think we can predict that. There are probably a couple scenarios that could play out. One would be that there could be a smoldering case reports in countries until there is a spike, and then there's a much higher caseload. I mean, what's occurring, as you know, in China with the containment efforts, their case reporting has diminished as far as the frequency of new cases. Where we're seeing now the spikes recently in South Korea, Italy, and Iran, where there was a huge caseload, almost like a new outbreak in those regions. And so when that happens, then there's an increased risk of transmission. And so it may happen like that in the States where we'll have occasional cases or we'll have mini outbreaks. Now that we're vigilant and our awareness is high, we also have diagnostic testing that's a little bit more readily available. It's in the state health departments rather than waiting to send everything out to CDC. The amount of days it would take would be greater. So I do think that as we start getting a handle on better case definition, getting people diagnosed sooner, I think we're going to have a better understanding of how this outbreak is going to take place in the States.
Okay, we're getting questions coming in, and somebody wants to know, are people with asthma more at risk? And those would fall into the category of somehow kind of immunocompromised, correct? What would you
Yes.
say to them? Yeah?
That's correct. Yeah, when you have asthma, you have bronchospasm, which is when the respiratory tree doesn't always open as well when you have active asthma. And so, yes, they are at a greater risk. It's also one of the indications for getting the pneumonia vaccine and the flu vaccine, so underlying asthma. So, yes, you would be considered at greater risk.
One of our other viewers wants to know, what do we know about people who contract coronavirus but then get better?
Mm-hmm. Well, the majority of people who contract coronavirus will get better without any long-term effects. About 82% or so of the cases tend to be mild. And so often what we'll see is that their symptoms will diminish over a period of perhaps 5 to 7 days. They are still capable of transmitting the disease. But for the most part, that's going to be how it's going to play out for the majority of people. When you start looking at people who have higher risks, including heart disease, diabetes, asthma, as we brought up, and other vascular disease problems, they're going to be at higher risk for having more severe disease.
We have gotten a lot of people wondering about their travel plans. People book these fabulous far-flung vacations, months and months in advance, and now all of a sudden, coronavirus is in the news, and they're wondering whether they should kind of change their plans. We just got a question from somebody, and they said, we're leaving for Mexico tomorrow for a 2-week vacation. Should we cancel? Should we be concerned? Would you be able to give them any direction of which way would be the safest health-wise to go?
Yes, I know that the CDC is issuing travel advisories, level 2, level 3, where there's a greater concern in the country. What I would say for the most part is, take a look at the current stats that are being set out daily. They're being updated daily. And if that country has a low case burden, it's very unlikely it's going to affect their travel. On the other hand, if there are cases, just as we saw in Italy and South Korea, where it is possible that this could change over a period of 1 or 2 days. While you may not be directly affected when you're traveling, your plans may be, because things shut down when with containment efforts. So I think it's important to keep that in mind too when you're planning.
Somebody else wants to know, is airline air safe? Because you always hear about everything being recycled and recirculated, and it's like you're always feeling like it's germy. Is it safe?
I'm not exactly familiar with all the dynamics of this, but it is recirculated. That is correct. So if something is airborne, there is a very minimal possibility of potentially spreading that way. But for the most part, when we investigate outbreaks on airplanes, it's usually within that 6-foot radius. And nevertheless, when anyone's on a plane, there's always a possibility there that they could come across secretions from someone who's sick. So that's always a little bit of a hard answer.
So, can you give me a little more context about coronavirus? Because I was listening to other reporters who, the one I'm thinking of was the science and health reporter for the New York Times. And he said the coronavirus really is, there are a variety of strains, if I'm using the correct terminology. MERS is a type of coronavirus. SARS was a type of coronavirus. But he said there were like 4 coronaviruses that we would just call like common colds. So, who is most at risk for getting coronavirus? Are kids, which we've heard, are they not as susceptible? Is it just the elderly? Can you give us some kind of feeling or sense of what is true?
Okay, I think one example would be looking at the flu as an example. We have a seasonal flu where there are several strains that tend to cause the flu. And we surveil areas where they have incidents of the flu year-round so that we can then formulate our vaccine plans. Nevertheless, there are other types of flu, avian flu, and other where we can see a dramatic shift, and then that can cause an epidemic as this. So in a way, coronavirus is like that too. There are several strains, about 5 or 6, that cause the common cold. And we get those year-round, or certainly worse during the cold season. But there are these epidemic strains which generally pass from one animal to another animal, and a spillover can occur where our immune system hasn't recognized this as a pathogen before. So there's a great inflammatory response as well as the infection. So it's a little bit of how our body is not familiar with that virus, and it's causing a much greater inflammatory response.
Okay, this is a great question, I think. Somebody over here is asking, I'm just going to read it. If we become sick and need to be hospitalized, how do we go about contacting authorities for instructions on what to do? Will there be one main base for calls, or do we directly call the hospital?
Great, that's a very good question. If someone becomes sick, the most important thing is, I really want each person to think about how sick are they. If they have mild symptoms, like we'd expect the majority of people to have, or if they have immunocompromised states like we talked about, including vascular disease, diabetes, but they have milder disease, they don't need to do anything but stay in their house and manage this out. Because I think the concern here is we have 2 different issues. One is the individual, and then the other is the community. And so we want to try to avoid spreading this through the community. So the last place you would want to go to is in the clinic or in the ER if you have mild disease. Nevertheless, if you have more severe disease, then it's important to contact the hospital triage system. And again, that needs to be talked through. It's not just, sometimes we can, consider someone who has moderate disease, they could stay home. But when it comes to some of those concerns, for the most part, we expect that we're going to see milder disease. When someone gets to the point where they're sick enough the hospital will decide to admit the person. And it is in that case, the infection control team, infectious disease specialists like myself, will contact the state health department so that we can then facilitate getting the test done. So it's not really up to the patient in that setting. It's through evaluating the patient.
Okay, boy, people are really interested in symptoms and kind of classification. So I'm going to start on two opposite ends. This question has been up for a while and I haven't been able to get to it, but they want to know, parents apparently, symptoms and risks for infants. Would that be different than the general population, as far as symptoms at least?
Yeah, well, unfortunately, we don't have the infant telling us their complaints, so sometimes it gets a little harder to evaluate. But as you would expect, with the respiratory tract infection, it would usually result in nasal congestion, maybe an increased irritability. From what we know through this epidemic is that for the most part, there haven't been any deaths in children, and infection has generally been milder.
And then somebody is asking, what is considered medically at risk? Is it like diabetes, heart disease, COPD, etc.? Or does that refer to people who are in care facilities?
You know, those actually, both of those categories would be considered generally at increased risk, and there's a few different reasons why. So chronic diseases affect our immune system, and it affects our ability to mount a response to this. And so studies are already suggesting with the outbreak that several different conditions come up, which we talked about, diabetes and heart disease and lung disease. However, another risk factor is age. And so if you look at the mortality rates in those that, or the case fatality rates in those that are older, they are much higher than in those that are younger. So age is another cause of immune deficiency. Age is an immune deficiency state.
Okay, Dr. Cirino, hang tight for just a second. I'm going to bring in one of my news managers. He literally just walked over with a big, long right through. Tell me, what is this that you've got?
Just wanted to let everybody know this is coming in from the Umatilla Indian Reservation Board of Trustees, but basically the headline is the Wild Horse Resort and Casino. A staff member at the Wild Horse Resort and Casino tested presumptive positive for the coronavirus. They are closing the casino. As I'm reading this, the Wild Horse Resort and Casino will be temporarily closed to sanitize the facilities. Closures will take effect noon, March 2nd. That's today.
That's today. Mm-hmm.
They're not saying when it's going to be reopened. In addition, all community events at the reservation are canceled for the week of March 2nd through 8th. So I'll leave that with you.
Okay,
so
thank you,
discuss.
Paul. I appreciate that. So you touched on this perhaps a tiny bit, but as more people are hearing about this and are recognizing their symptoms as perhaps something that's not influenza, are we going to be hearing little pockets of these pop up more and more and more?
Yes, and I suspect, like we had already suggested, is I do think there's probably some transmission already occurring. So as the outbreak develops, we're going to have less of a tie to those original associated cases in China. And so we will need to redefine who our at-risk groups are, and that's already been done. So I think we are going to be more aware of that as we have increased vigilance with the healthcare workers, being more aware that the cases are around, as well as we have now tests that are readily available to the state, where the turnaround time could be as soon as 1 day. So I think that's going to help us to get an understanding of how significant this outbreak's already occurring here.
So we hear that the virus can live on surfaces. How long can it live on surfaces, and what is the best way to disinfect those surfaces?
Yeah, that's a really good question about the length or the duration of time a virus can still remain infectious. And there has been an article recently released at the end of January, approved, that basically suggests that some of these viruses, including SARS and MERS, as well as just a standard coronavirus, can persist and remain infectious for several days on various surfaces, including metal and plastic. But one thing that is very important to stress is that temperature is an important factor, as well as particle burden, what the amount of viruses that are within the respiratory secretions, and probably respiratory droplet size are all factors. So I think when it comes down to it, the most important thing is that these surfaces can be easily cleaned with 60% or greater alcohol-based solutions, sodium hypochlorite, which is bleach, even dilute bleach would be effective, and there are several other products that are available.
All right, we want our
So
viewers to. Oh, go ahead. Didn't mean to interrupt you.
I was going to say, just the important messaging is that, that this is not the typical way to transmit, that a virus is transmitted. It's typically person to person. So yes, there are surfaces and inanimate objects, what we call fomites, which can be a source of transmission, where we then insert the contaminant, the virus, in our mouth or our other membranes, including our eyes or our nose. Though this is probably not the main risk factor.
Can you just kind of take a little deeper dive into how the virus infects you? When I think of just a regular cold, I'm all slurpy, and you're sneezy. But the coronavirus gets down into the lungs, correct?
Mm-hmm. That's correct. And it's very similar to the flu in that regard, very similar to influenza, where basically the virus is carried through the droplets that are then taken in. And basically the virus connects to sort of a lock and key type of a mechanism where it connects into the affected cells, which are usually, in this case, respiratory syncytial cells, which are the membranes of the respiratory tract. And then they basically get in, the genetic material gets in, and then it uses the cellular mechanisms of our cells to generate more copies of itself, which then self-assemble and then go on to cause damage within the cell and then infect other cells.
We want to let everybody know we want them to join the conversation as well. You can text us your questions at 503-226-5111. We are monitoring those, and we'll be talking to Dr. Christopher Cirino with Adventist Health about coronavirus, and he'll answer your questions. Somebody wants to know, I am symptomatic for COVID-19 with above 100-degree temperature. What do I do? They're saying that definitively. I don't know if that is literally just the way that they wrote it, but it says, I am symptomatic for COVID-19. Yeah. I suppose other things could cause a fever, but they're wanting to know, what should I do?
Yeah, that's a really good point. Again, the background of this is that we are still in the flu season. So we often see influenza B cases, but also influenza A and other respiratory viruses. So it would be hard for that person to make a diagnosis immediately that they have COVID-19. We do, some of the criteria that we're using is, in fact, similar. Someone who has a fever with a cough with an epidemiologic linkage. However, when we see someone who is with a severe presentation who has a fever and a cough, then we will test them for COVID-19. We're not actively surveilling people who may have symptoms. They could potentially have COVID-19, but we're getting a better understanding of what the penetration is. That is, how much is already being transmitted.
Does coronavirus have a season? Because I think of cold and flu season as like fall and winter. And we are still in winter, just heading into spring later this month. But would we see a lessening of the number of cases in the summer? And might this come back in the fall or winter, or does it not work that way at all?
That is what we're still trying to learn, and I think that remains to be seen. We certainly see an increase of viral transmission during the colder months, and there may be some reasons to that. But again, I always go back to influenza because it's a good model to understanding this. Is in the tropics, influenza transmission is year-round, potentially risk. Someone is at risk year-round. So it still remains to be seen what's going to happen with coronavirus. Could it potentially dwindle in the case reports in the north and south hemispheres, whereas maybe it could continue within the tropics. That still remains to be seen.
Somebody is asking here online what percentage of people who have died from COVID-19 were smokers?
I don't know the statistics on that. What I would say is in Wuhan, China, there was a mortality, or I should use the correct term, case fatality rate of 4%. There was a predominance of men in the original outbreak. And as we know in China, up to 60% of men smoke. I think that's a correct statistic. So I think that is definitely a risk factor because of its association with causing lung inflammation. So that inflammation can render a person more at risk for having a more severe presentation. So I can't give you a correct answer on that. I think as the outbreak becomes more clear, when we have the correct testing available, we get more cases, we'll be able to really get understanding what are those risk factors.
Can you give us a ballpark for somebody asking about how many people have fully recovered from coronavirus?
Yeah, that's a harder thing to say, because what we're getting is we're relying on follow-up data once we have a case that's reported. So you may see when you look at the daily records of who's recovered that there's this ballpark figure of 30%, or I think it's about 39% that have fully recovered. Part of that is dependent on reporting of those people. So we may not ever get an understanding. Bear in mind that the majority of people will have minor infections, and they're probably not following up on whether they've recovered, and yes, they have.
So if someone gets this particular coronavirus and they fully recover, can they get it again?
I would say that for the most part, we're seeing fair consistency with the same virus. I will say that even within a person, whenever we have virus replicating, or making more copies, there's always a risk that some mutations will develop. And in effect, most of those mutations tend to be harmful to the virus being able to propagate. So what I would say for the most part is we're dealing probably with the same strain. There is going to be kind of a big term, polymorphisms. There's going to be some differences that will happen. And fortunately, we will be able to test the sort of a genetic fingerprint, if you will, of the virus. And so we'll be able to see how much of this has changed. And again, I go back to the flu, where we see shifts, we see drifts of the virus in how its signature is. We call that antigenic drift. And so I think we would expect to see that with coronavirus.
Okay, and one other thing, somebody else is asking you, they say, I know somebody dear to me who's HIV positive, and was wondering what the risks are for that particular person, that type of patient.
It's a good question. It really depends on how they're treated. If someone has HIV, if they're treated and their immune system is robust, then it would be very unlikely that they would be at a much worse prognosis. And so for the most part, it would be fairly comparable to the general population in that age and other risk category.
All right, Dr. Christopher Cirino, we so appreciate you joining us for the last half hour, kind of giving us, again, the facts about coronavirus. Christopher Cirino is with Adventist Health. He is a specialist in internal medicine and infectious disease. And again, you have just been a wealth of information. We thank you so much for all your expertise.
I'm so pleased to be able to give this information out to the public and get the messaging out. Thank you so much for having me.
Absolutely. And we do want to let you know that here at KGW, continue texting us your questions to 503-226-5111. We have a team of people monitoring all of them. We're going to be working hard to get you some answers from the experts. And also, if you text FACTS, FACTS, to 503-226-5111, you will find a link. We'll send you one to all of our coronavirus coverage on kgw.com. So I'm Brenda Braxton. Thank you so much for my crew and Wendy Gatlin, who's been here riding shotgun with me, feeding all the questions that you've given us. We really appreciate it, and we'll see you next time on the stream.
Thank you. Thanks, Brenda and Wendy.